Hi, I'm Dr. Craig Castanet of Backstrong Clinic. I'm going to talk to you a little bit about how you deal with an acute injury, something that you just recently did, so that maybe you can avoid going to a doctor for it. You can certainly try these things most of the time on your own for a couple days to see if you start trending better, and if you do, then oftentimes people know that they don't have to go see the doctor. And if, of course, if it persists and or you're concerned about it or it's recurrent, then maybe you need to see a doctor. But initially, and this is very important, and that's why I feel like I need to make a video about this, I sometimes get patients, they had an acute injury, maybe it happened a day or two or three or four, or maybe a week ago, and it's still persisting, and sometimes it's worse. You should be mindful that when you've experienced a recent injury, very often if it's musculoskeletal, on a microscopic level, there may have been some tearing of muscle and ligamentous fibers. Tearing of ligamentous fibers is quite common, especially in the spine. The discs are ligamentous fibers in part, and when they tear, it's part of the degenerative process that can give rise to pain. And these sorts of tears give rise to a chemical inflammatory process that actually will increase over the course of 1 to 2 to perhaps 3 days. The worst thing you could do for any chemical process that you don't want to encourage is to put heat on it. You may recall from science or not that temperature is defined as average kinetic energy, meaning the average kinetic energy or the movement of molecules that make up that are measured in terms of their temperature. So when you have an inflammatory process that started as a result of a trauma, then you've got a chemical process, and you want to reduce that chemical process by reducing the temperature in the area. So heat would be the worst thing to do. If you put heat on it, it will increase the parameters that are inflammation, that is redness, swelling, heat, pain, and loss of function. So what you want to do is put ice on it. That reduces the redness, swelling, heat, pain, and in time will improve your function. So you want to put ice on it, I would say, for at least 20 to 30 minutes at a time. You probably don't want to go beyond about 30 minutes, although in truth I can tell you that I've done that on occasion for myself. But generally 30 minutes, then you get the ice off, let the circulation reestablish itself, then you can do it again perhaps an hour or two later in 30-minute increments, about 2 hours apart. That helps with the inflammatory process. If you put heat on it, you'll make the problem much worse. Many of the people I see that have had an injury a week ago and who have not had improvement and have not seen the injury trend better over time have had the problem get worse because of the heat application. And it's the first question I put to patients who I think have an inordinate amount of pain given when the injury happened and what I would expect in the way of their natural improvement. The other thing to do that's worthwhile is to take anti-inflammatory medication for a couple of days on a regular basis to try to quell the problem. If those two don't suffice, the ice and anti-inflammatory medication don't suffice to get you trending better the way you would expect and resolving the problem, then at that point you probably need to see a doctor and get the problem investigated. So I hope that helps. I should also mention that when you have an acute injury, there are reflexes that go to the regional muscles, and those reflexes tell those muscles to get tight and guard and splint the area to prevent that injured area from moving. It's trying to protect the area, and you'll be aware of that muscle tightness. That's part of the process. There's no point in directly treating the muscle process itself. Those muscles are doing their job. What you have to do is treat the initiator of that muscle guarding, that is the underlying injury and the inflammatory process. When you treat that effectively, the muscle tightness will abate on its own, and that source of pain will go away as well. Many people are preoccupied with the muscle tightness. In fact, many doctors focus some of their efforts on muscle relaxer medications to reduce the muscle guarding, but that's really probably superfluous. If you treat the underlying inflammatory problem, you don't have to worry about the secondary muscle issues, and you don't have to take the muscle relaxers that have sometimes unpleasant side effects. There's no harm in doing it in the short term, but you should know that it may not be necessary if you deal with the underlying inflammatory process, and you have to do that if you expect the muscular problem to get better in time. If you continue to have a chronic inflammatory problem, taking muscle relaxers to treat the secondary muscle guarding is really pointless. So I hope that helps in terms of treating acute injuries. The other thing, let me just point out one last thing. There's an acronym for the way you generally treat these problems, and it is RICE, R-I-C-E, meaning rest, ice, compression, and elevation. So when you have a swollen or inflamed area, you want to rest it from a lot of physical movements and demands. You want to ice it. You want to compress it if it's something that is compressible. You couldn't compress something in the neck because you'd have to wrap something around the neck. You can compress, however, an ankle injury, and the last component is elevation. You want to, if it's an extremity issue, you want to elevate it because that, by virtue of gravitation, reduces the swelling component that is a component of inflammation. So the acronym for the inflammatory process is RSHP, redness, swelling, heat, and pain, and function is a fifth component. And the acronym for how you treat these problems, these inflammatory problems and injuries, is RICE, rest, ice, compression, and elevation. Hope that helps, and if we can help, feel free to call us. Thank you.